All right, let's jump right in. Think about this for a second. Your body has this incredible master filtration system. It's working nonstop, 24/7, just to keep your blood clean and perfectly balanced. But what happens when that system starts to quietly fail? Well, that's exactly what we're talking about today: chronic kidney disease, or what you'll often hear called CKD. And look, this is not some rare, obscure condition, not at all. Get this. Estimates show that a staggering 10 to 14% of the entire world population is affected by CKD. It's often called a silent disease, and for good reason. You might not feel any symptoms until the damage is already pretty serious. So, what is it exactly? The definition here is super important. We're talking about a progressive loss of kidney function. And those keywords are everything. Progressive means it gets worse over time. And irreversible, well, that means exactly what it sounds like. This isn't something you can just bounce back from like an acute injury. The damage is permanent, and it's been going on for more than 3 months. Okay, so to really get our heads around this, here's how we're going to break it down. First, we'll cover what the kidneys actually do. Then we'll look at the two main culprits that cause them to fail. After that, we're going to zoom in on the damage itself, see the ripple effects across the whole body, and finally, wrap up with how it's all diagnosed and managed. All right, section 1, the body's master filter. It's easy to forget just how much our kidneys do. They're an absolute powerhouse. I mean, they're not just filtering waste out of your blood. Oh no. They're also balancing your body's water, salt, and potassium levels. And on top of that, they're producing critical hormones for things like blood pressure, making red blood cells, and even keeping your bones healthy. So how can you even measure how well this filter is working? Well, it all boils down to one key number: the GFR, which stands for glomerular filtration rate. The easiest way to think about it is just the speed of the filter. A healthy kidney, it's churning through about 100 to 120 milliliters of blood every single minute. But with CKD, that number just keeps going down and down and down. And, this is a really important distinction to make because people get this confused all the time. Chronic kidney disease is not the same thing as an acute kidney injury. An acute injury is sudden. It happens fast, and a lot of the time, it's reversible. CKD, on the other hand, is the total opposite. It's a slow, steady, and sadly irreversible decline. Okay, so what is it that's actually causing this incredible filter to break down? I mean, there are a bunch of potential causes, sure, but it turns out two of them are responsible for the vast majority of cases. And wow, this chart really says it all, doesn't it? Diabetes and hypertension, high blood pressure, those are the two big ones. Together, they are responsible for a whopping 70% of all CKD cases. They are, without a doubt, the main drivers of this whole problem. Of course, it's not just those two. There are other things that can contribute for sure. We're talking about genetic conditions like polycystic kidney disease, certain infections, autoimmune diseases like lupus, and even the long-term use of some common medications like NSAIDs. All right, so now for the big question. How do these conditions, especially high blood pressure and diabetes, actually destroy the kidneys? To understand that, we've got to zoom way in and take a look at what's happening on a microscopic level. With high blood pressure, what you get is this really nasty feedback loop. First, the high pressure damages and narrows the tiny little arteries that feed the kidneys. So the kidneys sense they aren't getting enough blood. They panic. And in an attempt to fix the problem, they release a hormone that actually raises your blood pressure even more. You can see how this becomes a vicious cycle, right? It just spirals, leading to scarring and permanent damage. Now, diabetes does something similar, but it gets there in a different way. All that extra sugar in the blood makes the kidney's tiny blood vessels stiff and clogged up. This creates this high-pressure situation inside the filters, forcing them to work way too hard. It's a state called hyperfiltration. It's like redlining a car engine for years. Eventually, they just burn out and get scarred. Okay, let's zoom back out to the big picture. Because when this master filter starts to fail, the problem doesn't just stay in the kidneys, not even close. It sets off this huge cascade of complications. It's literally like a series of dominoes tipping over, one after another, all throughout your body. Yeah, when the kidneys aren't doing their job, pretty much everything goes haywire. Your sodium, water, and potassium levels get all out of whack. Dangerous toxins start to build up in your blood, and all that crucial hormone production we talked about, it gets totally disrupted. Let's dig into a few of these dominoes. So the very first domino to tip over is usually fluid balance. It's simple, really. If the kidneys can't get rid of extra salt and water, where does it go? Nowhere. It stays in your body. This leads directly to fluid overload, which you might see as swelling. That's called edema. And you guessed it, it makes that high blood pressure even worse. Next up is potassium. Healthy kidneys are fantastic at getting rid of any extra potassium you don't need, but when they fail, that potassium builds up, and that is seriously dangerous. It's a condition called hyperkalemia. And why is it so bad? Because potassium is critical for your heart's electrical system. Too much of it can cause muscle weakness and, scarily, life-threatening heart rhythm problems. And then there's all the junk that's supposed to be filtered out. When waste products like urea, which should be going out in your urine, start building up in your blood, you get a condition called uremia. And it is literally toxic to your body. It can affect your brain, causing everything from nausea and exhaustion to confusion and, in the worst case scenarios, even a coma. Remember how we mentioned the kidneys make hormones? Well, here's a perfect example of why that matters so much. One of those hormones is called erythropoietin, and its job is to tell your bone marrow to make red blood cells. When the kidneys are damaged, they don't make enough of it. The result? Anemia. And that's why so many people with CKD feel constantly tired and out of breath. And believe it or not, it even affects your bones. See, your kidneys have another critical job. They activate vitamin D so your body can use it. And you need active vitamin D to absorb calcium from your food. So, no active vitamin D means low calcium in your blood. Your body, trying to compensate, starts pulling calcium right out of your bones. Over time, this just leaves them weak and brittle. Okay, so after hearing about all of these pretty serious consequences, you're probably wondering, how do you even find out you have this, and what can you do about it? Well, that brings us perfectly to our last section, diagnosis and management. Diagnosing CKD is a bit like detective work. Doctors use a few key clues. They'll track that GFR number we talked about for at least 3 months to see if there's a steady drop. They'll also check your urine for protein. That's a huge red flag for kidney damage. And sometimes they might need an ultrasound or even a tiny tissue sample, a biopsy, to really see what's going on. Now, since the damage is irreversible, the whole goal of management isn't to find a cure. It's all about hitting the brakes, slowing down the disease as much as humanly possible. And the best way to do that is to go after those two main culprits we identified, blood pressure and blood sugar. Controlling them aggressively, often with specific medications that also help protect the kidneys, is absolutely key. But if the disease keeps progressing and gets to the final stage, that's when the GFR drops below 15, the kidneys just can't keep up anymore. At that point, you need something to take over their job completely. And really, there are only two options: dialysis, which is a machine that filters your blood for you, or a kidney transplant. And that really leaves us with one last and pretty sobering thought. We know the main causes of this disease, diabetes and high blood pressure, are on the rise all over the world. So you have to wonder, is this silent disease quietly on its way to becoming the next silent epidemic? It's definitely something to think about.